Hi, everyone. On today's podcast, we're going to talk with Scarlett Lynsky, birth doula and evidence-based childbirth educator and two-time gestational surrogate about the importance of birth education and the challenges and joys of surrogacy. Welcome to the Evidence Based Birth Podcast. My name is Rebecca Decker, and I'm a nurse with my PhD and the founder of Evidence Based Birth. Join me each week as we work together to get evidence-based information into the hands of families and professionals around the world. As a reminder, this information is not medical advice. See ebbirth.com/disclaimer for more details. Hi, everyone. My name is Rebecca Decker, pronouns she, her, and I will be your host for today's episode. Today, I'm so excited to talk with Scarlett Lynsky of Hatchings Doula service. Before we interview Scarlett, I want to let you know that we will be talking about supporting family building, especially for those experiencing infertility or miscarriage and those who are seeking assisted reproduction. If there are any other detailed content or trigger warnings, we'll post them in the description or show notes that go along with this episode. And now I'd like to introduce our honored guest. Scarlett Lynsky, pronouns she, her, is an evidence-based birth instructor who teaches our childbirth class and a spinning babies trained birth doula. Scarlett's services can be found online at hatchlingspdx.com. Scarlett lives in Portland, Oregon with her partner and two children, where she shares her passion with laboring people as a doula, now having attended well over 200 births, and she is a two-time gestational surrogate. We are so thrilled that Scarlett is here to talk with us. Welcome to the Evidence Based Birth Podcast.
Hi, thanks so much for having me. I'm excited to be here.
We're so thankful you are taking time out of your busy schedule to talk with us. And I got to see you in person in Portland this past summer. And I was just like, we got to get Scarlett on the podcast so you can share your story. I was wondering if you could start by telling our listeners what inspired you to become involved in birth work in the first place.
Sure. Yeah, I think it starts pretty early for me that I got the call. I was about 16 when I picked up a birth book off the table at a bookstore. And I think it was Grantley Dick Reed's Childbirth Without Fear. And I bought it because it was on sale and I read it cover to cover and I was so interested, but I didn't really think of it as a career choice. In fact, I didn't go around telling everyone that I was interested in birth. I just was like, that's fascinating. And then I kept it all to myself. So, I went to college. I did other things. I became pregnant with my first child when I was 23. And it was not a planned pregnancy, but I was excited about it. And, the situation was like, I ended up having a home birth because it was inexpensive. My insurance was going to cover part of it. My mother had a best friend who was a home birth midwife, and I was born at home. So everything about it just kind of felt pretty normal to me. And I had a really great experience with my home birth. And from there, I couldn't ignore that I was really into this whole birth process and how it changes a person. And so I started with becoming a childbirth educator, which meant that I needed to attend some births. So between learning about birth and then also attending births kind of as a doula, but not a trained doula, I just felt so at home there. Even though it was all new, I kind of had an instinct for what might be helpful in that situation. And so I feel like it kind of found me. I didn't intend to become a business owner. I didn't even intend to become a doula. I just started doing births. And then after I had done a few, I took the training and added it to the list of things that I did. And after a few years, that just became my job.
And tell me a little bit more about your home birth. Did it go smoothly, like as planned? Was it, what was it like?
Yeah, it went very smoothly. I was quite lucky in that way. And it's not that I think I had a certain amount of blissful ignorance, being young, and I wasn't in the birth world at that time. So I hadn't really seen all of the many different ways that a birth can go. But we weren't oblivious. I remember asking the midwife, okay, what happens if there's an emergency, and talking about, how close were the hospitals to us and how she would handle an emergency. And she talked to us about how a lot of times things that don't go well in birth go, they happen kind of slowly, where there's enough time to really see that something needs to change. But no, I had some very mild, pre-labor, early labor throughout a day. I was about a week past my due date, but the labor really picked up at nighttime in the evening. And then I labored overnight. I was able to get in the tub at probably around 6:00 in the morning, and my daughter was born at 9:30 in the morning. I will say, I forgot this part. I did have a hemorrhage. At home. My midwife was able to control it, so we didn't need to transport or anything like that, but it left me kind of depleted for about a week or so after the birth.
Okay, and what did the midwife do to manage your hemorrhage?
Uterine massage. I mean, she did actually a really interesting thing, which is she looked me straight in the eyes and she said, "I need you to stop bleeding now." And that may not work with everyone, but it actually worked with me. So it stopped, it slowed down. She had Pitocin ready, but I didn't end up taking it. Mm-hmm. And just after the fact of trying to stand up, I lost consciousness. So I was like kind of stuck to the bed for about a week, which in a way was probably helpful for my postpartum because I just laid in bed for a good long time, just recovering.
And was home birth like something that was kind of normal in your community? Because I know you live in the Pacific Northwest where it's more common, but at that time period, did you know other people who were having home births?
Yeah. I mean, right now in Portland or in Oregon, I think when you're talking about community birth or out of hospital birth, it's about 4%. And I think 1.5 or 2% of that is home birth. At the time, so this was 20 years ago, it may not have been that high. It was probably, I'm going to guess like 1% out of hospital births, maybe 2%. I didn't know a lot of other people who were giving birth at that time. So later, as I brought my child and my children to the play park and the park, I did meet a lot of other people who had home births. It was a little bit normalized for me because I'm the third child. I was born at home. My younger brother was born at home. So I had grown up hearing those stories. And my mom was a teen mom with my oldest sister, and she had a hospital birth and was pretty mistreated during that process with the rest of us. My next older sister was at a birth center that was also a naturopathic college. And then my brother and I were both born at home. So I think in general, like, even though it's in Oregon, we have one of the highest rates of community birth. It's still only 4%. Yeah. 96% of people are having births in the hospital. So in a sense, it's still it was and is a little bit more fringe.
And I can sort of identify with like none of my friends having babies at the time I had my first. I know like the average age at first birth in the United States is closer to 26 now. So at 23, you probably didn't have a lot of peers that were starting families and having babies yet.
Yeah. I did have a few friends that probably, were having kids within a year or two of me. But it felt really like we were the first.
So then you started just doing doula work and then getting the training. And then I'm assuming it was quite a bit later that you became an EBB instructor. Can you talk a little bit about your decision to do that?
Yeah. Well, I started following EBB pretty early. Like I remember, I think it was the eye ointment article that crashed all the servers. Is that right?
Yeah. Yeah.
So I think I must have gotten on the list, or I knew that it was coming out on a particular day. And then all of us that had started following you and following the blog, because there was just such a vacuum for that kind of information where it was really strong on the research, but it didn't have a sense that you were cherry picking the research to make a particular point. I was really hungry for that kind of information and the ability to share that with other people. So EBB was on my radar. And when the professional membership started, I don't think I was one of the first to join, but I remember thinking like, I want to give money to this organization. And even though I was like, I'm not sure I have time to watch all the continuing education, I didn't, it felt like a pretty decent investment for how much I was making. But I also I just was like, even if I never use any of this stuff, or I don't utilize it as much as I could, the fact that it supports all of the information that you're putting out into the wider world for consumers and for healthcare providers was just amazing to me. And the fact that you were paying a team to continue that research and keep it going was just so impressive to me that I joined as a professional member. I actually had been a childbirth educator for I taught my own childbirth classes for 9 years with a partner as head over heels birth education. And so I had written my own curriculum. I had taught my own thing, but my business partner had to drop out at some point. Just other life stuff was happening with her and it was getting hard to keep running the business. And so we closed it. So when the Evidence Based Birth Instructor training came up, I was not teaching another class and I was missing teaching. So the other thing that was really impressive to me, having taught my own classes, and that was and is really different about the EBB childbirth class, is the focus on advocacy. Most of us that have been childbirth educators, we kind of know what the system is like. We tell people their options. I would tell people their rights and responsibilities, but I really didn't have an answer for what happens when you get into that situation and you're sort of being told you only have one option, like how to handle that situation when you're in it. I just had really no tools for the people that I was teaching on that.
Yeah.
And the fact that the evidence-based birth childbirth class does that. It says, hey, these aren't bad people, but this is a system, and you kind of walk into this system to just be able to see that, break down the fourth wall and see what's in there, and then be like, oh, okay, so here's how that can be true, but then I can still say what I need and want and have tools for how to get that. That was the biggest reason that I wanted to become an evidence-based birth instructor.
And I do feel like it's only really been in the last couple of years that more childbirth educators and other programs are talking about advocacy. For me, it was always critical that it was going to be part of what we did at EBB, because I guess in my background as a nurse, but also as a family member of loved ones who've been in the hospital, I have had to be that person, like advocating for an elder or for a child. And really, labor and delivery, it's the same thing. Like, you have to be able to speak up. And I myself have been a patient in the healthcare system. So I've been there as a nurse. I've been there as a family member. I've been there as a patient. And it really took a lot of thinking, like, how do we handle these situations? And so it was really fun to put it all together into kind of like a systematic, all right, here's how we're going to train people in self-advocacy. Here's the scripts. Here's the role plays. Here's what we can do to not make it adversarial, but to just say, this is, speak our truth. Like, this is what we need right now in this moment, and do it without making enemies. And so it was definitely like fun to put that together. I'm glad that it was like, it helped. I think it helped a lot of doulas and childbirth educators who felt often stuck, like, you're giving your clients all this information, but then they get pressured into something and they feel yucky about it, but they don't know what they could have said.
Yeah. And I think even with all of that information, it still can be pretty sticky for people, but it helps to just understand the background and the behind the scenes and just how to work with instead of work against, or instead of just kind of take what's handed to you.
Yeah. And I think one way out that, we talk about the tickets out of the kind of hierarchy in the hospital, one way out is just to reject that model and go to a different provider, a different birth setting. And so a lot of our students find success doing that. And then some find success through sticking with the system that they're in because maybe they don't have a choice or they don't want to leave, but using the other tools that we give them. Can you talk a little bit about how this comes into play, either with doula care or childbirth educating, when you're working with, families and birthing people who are using other ways of family building that maybe some people would call, quote, non-traditional?
Yeah. I mean, I think what's fun about working with all kinds of different families is that everybody's different. And you get to kind of delve into a little bit of like where each person is coming from And if they're coming from different places, how to get them on the same page. So with all the births that I've attended, I've had parents that are, single parents, single moms. I've had same-sex parents. I've had people that are becoming parents through the surrogacy process. And that in particular, you just have more people involved, right? So you have the surrogate. The surrogate might have a partner that is involved and is supporting the surrogate. And then you have the parent or parents to be. They may want to be in the room. The surrogate might want them in the room. The surrogate might not want them in the room. And so you kind of have everyone's fears, worries, expectations, excitement, and you have to listen to everyone and start pulling everyone in so that as much as possible, everyone can be on the same page and supported in what their needs are.
And I imagine this kind of happens early on in the process in pregnancy, and then it kind of reaches this height or peak at the birth. Is that
Yes.
accurate?
So just like with, a traditional couple, you talk about as many things as you can talk about. How do you think this will feel? What do you think you want for this? And then some of that will be the same in the birth process, and some of it's going to change how you feel. So like, for example, I had one client who was a surrogate and she had a partner, but the partner was not going to be her support person. So she hired a doula. And this was during the COVID time. So there were some restrictions on how many people could be in the hospital room. That's a whole other thing to navigate. But she had invited so me, her doula, to be in the room with her, and as well as one of the dads to be. But she was a person who had these really quick labors. And in the moment that the dad showed up, she was about to give birth and she just couldn't have him in the room. And they had talked about that ahead of time. So it was an okay thing. But yeah, she was unmedicated. She just felt really open, vulnerable, whatever it was. She just was like, you just can't come in yet. You can come in right after the baby is born. And that's what happened. But initially she had thought she would be fine having one of those parents in the room. But sometimes in the moment, your gut just takes over and you need to know that you're not going to need to be self-conscious about, what's showing on your body or what sounds you make or whatever else might be going through someone's mind about what they want for someone else to see of them.
So there's more people involved in everything.
Yes.
Okay. With the surrogacy pregnancy.
Mm-hmm. Yeah. So there's more opportunity for miscommunications to happen or just unspoken expectations. So then I feel like the job of a doula in that case is to be asking people questions so that everyone can kind of get on the same page about either what's going to happen or just, we don't know how this is going to feel. So it might feel like this, it might feel like this, but are you okay with it happening either way, however it unfolds?
So with the doula's role, you're facilitating a lot more communication about choices and about, education and that sort of thing as well, and decisions. And I was curious, did you attend surrogacy births as a doula first before you became a surrogate, or was it the opposite? Can you tell us a little bit about your own journey and decision to become a surrogate and what inspired that?
Yeah. Like with a lot of things for me, it was a series of small events. And I actually cannot remember a moment where I decided, what I want to do is be a surrogate. As a person who's interested in pregnancy and birth, and, in my younger years, I would talk to people who'd had difficulty getting pregnant or who'd had multiple miscarriages. And I always wished I could take some of my own fertility and just rub it off onto them. Like, I just was like, I just want to help you. I felt this pull. And the backstory with me is like I said, with my first child was unplanned. My second child was planned, but it was one cycle. That was it. And so my experience with having children was almost too easy. And so when I would run into people, and I have a sister-in-law who couldn't get pregnant for 10 years. And I I wanted to help, but unsolicited advice is not great. And yeah, I just had this feeling that I wanted to help for people who were wanting to have a baby, but couldn't for some reason or another. And then I also had a friend who had fibroids that she'd had to have surgery for. She had had multiple uterine surgeries, and she had been told that she might not be able to carry her own baby. And when she was telling me that and her mixed feelings about it, I just said, I would carry a baby for you. And I didn't think it would ever come to that, but I totally offered that up. Like, I would do it. I would totally do that for you. Yeah. So there was a moment after my second child, the birth was very beautiful as well. And almost right afterwards, I was like, man, I don't get to do that again. That's shoot. I really kind of want to. So it was a few years later after he was born that I was like, man, it would be nice to do the whole process again. But like, we're kind of done with 2 kids. Like, it feels like the right amount for our family. But then I started thinking about my pregnancies and how they were very uncomplicated. I was still at an age where I could be pregnant again. And I really realized, oh, I'm actually a good candidate for this. There are a lot of people who consider surrogacy and they're like, it wouldn't work for me. I have hyperemesis, or it wouldn't work for me because I have had preterm births, or whatever the thing is.
I have migraines throughout my whole pregnancy. Like, I don't think anybody, I could ever do that for anybody, as much as I'd want to help, it's just too much suffering.
Yeah. I mean, there's so many things like that, where people are like, oh, I would have done that, except for, my pregnancies were really complicated, or they were just really difficult, or
I had difficult births.
My births were hard, or So when I started kind of ticking off all the boxes, I was like, oh, I could conceively do this. And then of course it took me a while to, talk to my partner about it and see what he thought. And then I was like, who do I talk to? And so for the first one, I went through an agency, and even then I had kind of just one foot in. I was like, well, I'll just, since I can't get this out of my mind, I will, I'll check it out. But if it doesn't work, it doesn't work. It's not meant to be. But that's not how it worked. I went in, and really, I think a few weeks later, I met with a couple, two men, and we hit it off. And then that's the couple that I carried for with the first surrogacy.
And how did that pregnancy go?
Pretty good. Well, actually, the first time I became pregnant as a surrogate, I had a miscarriage. And that was the first time for me. And it was what's called a missed miscarriage. So I took the pregnancy test, was pregnant, had a first ultrasound to detect the heartbeat. It was fine. And then usually there's a second ultrasound to just check that everything looks good before they release you to whoever is going to be your care provider. And it was at this one that they didn't find a heartbeat. It actually felt really great. I'd had no morning sickness. I'd had good energy. And yeah, it just turned out that this baby stopped developing. So that was an interesting and difficult thing to go through with the parents, because it's a loss, even though it's like not a loss of my baby, it's a loss of, like, I felt you still kind of feel responsible for this person that you're carrying and this thing that you're trying to do for another family. So that was physically difficult. And then that also meant that with the next embryo transfer and the next pregnancy, there was a little bit more fear for me going into that. And I also had what's called a subchorionic hematoma, or subchorionic hemorrhage, where I had some bleeding at around 6 weeks. The placenta that was forming had separated a little bit, and there was some, kind of like a bubble of blood behind that. And it can somewhat increase the risk of miscarriage, although it's also quite common. And I've heard more common in IVF pregnancies. So yeah, so there was definitely like a first trimester of fear that another miscarriage would happen. And I had more, and I definitely had some of the morning sickness in that pregnancy, which is more typical for me. But otherwise, the pregnancy went well. And this time it was a hospital birth for me, and that was my first and only hospital birth as a person giving birth. At that point, I had been a doula for, I think, 5 years. So I was really familiar with the hospital setting, but it wasn't something that I had done before.
Yeah. And I think you bring up a good point about, surrogacy. And one of the challenges is you may be faced with loss. I imagine statistics show that maybe there are slightly more complications with IVF pregnancies in general. And essentially, it is an IVF, just not with your egg or your partner's sperm, correct?
Correct. Yeah. So in this case, it was a donor egg and the sperm from one of the intended fathers. Yeah. And it's interesting. I mean, when you talk about the research, I do think IVF pregnancies have higher risk to them, but it's really hard I don't think that there have been studies on IVF with surrogates, IVF with a donor egg. So it's a little bit hard, I think, to tease out, are IVF pregnancies more high risk because you have a population of people who have enough health issue that they've had difficulty getting pregnant without the use of assisted reproductive technology. So is it just higher risk because these are people that have already some health issues, or that, or is it the process of IVF itself that creates a higher risk? And I don't think we know the answer to that.
Right. And I think you and I have talked before off air about how the whole field of assisted reproductive technology, there's a lot of gaps in knowledge, and also it's difficult to find evidence-based care, that sometimes things are just presented to you as this is the way we do things.
Sure. Yeah. The fertility clinic that we went with for the first surrogacy was adamant about doing bed rest after an embryo transfer.
Wow.
And
you were a mom.
I'm a mom, and also I was doing doula work. So there's this feeling of, okay, if I'm called to a birth and I have to send my backup because I have to be on bed rest, but I'm actually fine and there's no really risk to this pregnancy, I didn't want to take that chance. It never happened, but I did I did my own kind of like research deep dive, and I could not find a research study that showed that it was beneficial to do bed rest.
Yeah, which makes sense because it's not beneficial even with complicated pregnancies. There's research on that. I think we've covered it before on the EBB podcast, but I can't remember. It also reminds me of, we had Ambrosia come on the podcast. She's also an EBB instructor, and she shared her surrogacy story in episode 132, where she had a really difficult situation with a twin pregnancy and experiencing a loss with one of the twins. So it's one of those things that I think, I think of surrogacy as like kind of like it's all happy and you're carrying somebody else's baby for them, but there's also challenges, and you may be faced with loss, and that can be really difficult. So going back to getting pregnant though, since you are the receiving person of the fertilized egg or the embryo in this case, did you have to take any medications or do anything to prepare your body to receive the embryo?
I did, yeah. And again, I've done the process twice with 2 different fertility clinics. So the protocol differs a little bit each time. But both times they had me take this drug called Lupron, which I believe works on the pituitary. It kind of shuts down your hormonal production. So they would have me take birth control pills to make sure I didn't have a cycle. And then I would take this Lupron, which is a subcutaneous injection in your stomach. And then on a particular day, you would start taking estrogen. So with one of the clinics, that was an oral estrogen. With one of them, it was an intramuscular injection. And then on the day that you would have ovulated, but you're not actually ovulating. So each time it was a 5-day embryo. So you would tell your body that you had just ovulated and begin giving progesterone and oil, which was also an intramuscular injection. And then 5 days later, you would have the embryo transfer, and then you would continue taking the estrogen and the progesterone. And maybe it was just the progesterone throughout like the first trimester.
So the second time with this family, you were able to stay pregnant the whole or up to term?
Yes.
Correct?
Yes. Yeah. It was the first time that my water bag opened before labor. So I had premature rupture of membranes, and I ended up going into the hospital before I was in labor because they wanted me to. And then it took a while before I actually got into labor. And that was a little bit interesting too, to figure out like why it wasn't happening. I have a sense that perhaps if I was at home and I wasn't being watched and having people come check on me all the time, that I might have gone into labor a little bit sooner. But once I actually did go into labor, the process was about 5 hours for me.
So they had to use Pitocin to get things started or not?
They did not use Pitocin, but it was definitely a conversation that we had. And ultimately, I had a doula that time, and I talked with my doula, and I talked with my partner. And because I just didn't feel like I had enough perspective, I just didn't have a clear idea. I didn't really want to take Pitocin, and I didn't think that I needed it. But of course, we were probably 17 or 18 hours in to having my water broken, and I wasn't in labor. And so I was like, should I? What do you think? And I remember my doula said, I think you just need some space. My husband and I asked just for an uninterrupted hour. The doula gave us this little bottle of clary sage essential oil and said, like, you can throw a couple drops of this on the bottom of the shower and you can get in the shower. So I ended up doing that, getting in the shower. And for whatever reason, pretty quickly, the waves that I was having really intensified. And it was just a whole different ballgame after that. But I did notice after I came out, I was like, we have to turn down the lights, which is not normally my thing. And I was like, you guys, I can't talk to anyone because if I talk, then my waves just go away. So I was like, you're allowed to talk. And until I got into active labor. But this also happened with my second birth, was that people came over, I was chatting with them, the waves totally went away, but I was at home. And so it wasn't a stressor. It just was, I was like, okay, guys, you hang out here. We're tired. We're going to take a little nap. And then when we were laying down for the nap and there wasn't any, it was just me and my husband, there wasn't anyone around. And then that's when the waves started to pick up and it just went from there. So I didn't know that was like my pattern until this.
When you were like, I can't be chatting with people or my labor will slow down.
Yeah. I mean, I even at some point, like the midwife had come in and she was just observing and, I was making the low vocalizations during the waves. And she said, do you feel like you're in labor now? And the fact that she said that to me made me question whether I was or not. Like I started to second guess. I was like, oh, so wow, does it seem like I'm not? And I got all up in my head for a second, and it felt like the next contraction took so long to come, and I just went, okay, Scarlett, stop, don't think about this, and so I just closed my eyes back, and I just tried to block everything out, and it turns out that's what I needed. So I never actually took any Pitocin until after. Yeah. Until after the birth.
And who all was in the room with you then during the birth?
Yeah. So this was before COVID. So this was 8 years ago. So I had my husband, Seamus. I had my friend, Krista, who was my co-teacher. We've been friends since we were in 8th grade. And she also is a photographer. So I had her come and be a person who takes pictures. I had a doula, and my doula had an apprentice. So I had those two people there. And then the two dads were in town. But some of those people spent more time in the waiting room. So the dads came in initially when I was waiting for labor to get started. I kind of so when my husband and I got in the shower, we kicked everyone out of the room. Mm-hmm. It was just the two of us. Mm-hmm. Once things got going, I said, okay, we can bring the doulas back in. We can bring Krista back in. When I thought about bringing the dads in, who I thought that I wanted them to see everything, I just could imagine them not having a place to sit, just kind of watching me worrying about them. And they had told me that they would be fine with whatever I was comfortable with. So I just said, okay, they're they're hanging out in the waiting room. They're right here. When it became clear that I was about to give birth, which happened pretty suddenly, we didn't have a lot of warning, my friend Krista went out to the waiting room and grabbed them so they were able to come in and actually witness the moment of their baby being born. And then they were able to do some skin to skin after the cord was cut.
What was that experience like the moment of giving birth to help that family have a child?
I mean, it was awesome. It was great. For me, it was one of my more challenging births. Like it felt less calm, I think, than my first, second, and even fourth. Like I definitely had this moment, like the transition moment where I was like, guys, I don't think I can do this. It just felt really out of control, especially, so it was like transition and then pushing. And for me with baby number 2, 3, and 4, the pushing is under 5 minutes. Like it's just a couple of minutes. It's all of a sudden, it's overwhelming. And a couple of minutes later, it's done. And so I've always wanted to have just a super calm, like one of those people that like, I don't know, catches the baby themselves. Yeah. And it's like, and they're just breathing and it's so controlled. But for me, it just ends up like me being like, I tried my best. It just wasn't my story. But yeah, it's just an exciting moment. I think like once the baby's out, there's just such relief and you just feel like the flood of emotions. Then having them in there, and once I caught my breath, I was able to kind of like look and be like, take your shirt off, like do this skin to skin with your baby. Yeah, it felt great. It felt like an accomplishment.
What made you decide to do it again then?
The second time I did it for a different family, and this was my friend that I had originally offered. And it was just a situation that I couldn't pass up. It felt totally right. And we had hard conversations about, do we transfer 1 or 2 embryos? And I felt pretty strongly that I only wanted to transfer 1, but they wanted to kind of maximize their chances. And we kind of talked through all of that. And I just knew that it would work because every time we had conversations about all the really hard stuff that can happen during surrogacy and what my parameters were and what her parameters were, we were both really clear. Like, if this is a deal breaker for you, like, you can go with someone else, like no hard feelings. Yeah, we both just went into it feeling like if we can agree on all of the things, then this will be great. And if we can't, then it's just not meant to be for us, but you'll get a different surrogate and it'll
Well, what kinds of things do you have to agree on in order for it to be a good fit?
Yeah, I mean, there are all these things that oftentimes an agency will ask you. And we ended up not going with the agency just because we knew each other so well. And I had been through the process once before. But it's things like, in what kind of situation would you want to terminate a pregnancy? Some people, if you're a surrogate, it's your body. If you're so for some parents, if they find out the baby has Down syndrome, they might want to terminate that pregnancy. And that's their choice to do that. But if you're the surrogate and you would feel bad about terminating for that reason, then you're not a good match. And of course, things about the birth, right? Things, there's all this crazy stuff. I mean, in contract phases of surrogacy, you talk about like, what happens if you die as the surrogate? What happens if, one of the parents dies? What happens if, there's...
What medications can you take?
What happens if, exactly. Like sometimes intended parents want to have a say in what your diet is like, or there's just all these little things. What happens if you lose your uterus? Like, it's like, it's good to talk about, but it's also a little bit, it's a lot. Yeah. So the contract puts everything in writing, but it's a lot like informed consent, right? The consent form is not the consent. Like your signature there isn't the thing. The contract is supposed to just solidify that you've had all of these conversations and that everyone, has discussed and agreed. And then it's in writing so that if you forget what you agreed on, you can kind of go back to the contract. But you shouldn't just put stuff in the contract and just assume that it's all understood. You shouldn't have a match with someone where you don't fundamentally agree, because then the contract is then you could just have a lot of arguments over the contract. But
yeah, I was gonna say there's got to be there's so much labor in pregnancy itself, like the labor of all the aches and the pains and the nausea. But I was even thinking about like, what if you want a massage because your back is killing you, and you want a professional massage? Like there's got to be like tons of little details that go into like, does this get reimbursed or not? Like, yeah, what are they covering? What are you covering? Etc.
Yeah. Yep. And I didn't ask for all of that with the first surrogacy, but the second time around, we kind of had a conversation of, I wanted to have an allowance essentially for things like that,
like going you want to go to the chiropractor or
chiropractic, massage, acupuncture,
yoga,
just kind of whatever. Yeah, exactly. Like an exercise program that would help me still feel really good towards the end of pregnancy. So in this, with my friend, we did kind of negotiate that so that was part of it. But it can be hard to think of all those things.
So take us to the end of that pregnancy. What was that birth like?
That was a beautiful birth. We ended up having a home birth with that pregnancy. And it was not at my home. It was at my friend and her partner and their home. So we had a water birth. I'd started to have some labor, but I had a kind of a longer early labor where I was having contractions every 10 or 20 minutes. I just knew that they were labor contractions and not just practice contractions just because of how they felt. So I thought it was going to pick up a little sooner. And I tried some things to get it to pick up sooner. And we'd gone to their house and my children wanted to witness that birth. So just when I thought, we're going to go to bed and we'll see what's happening in the morning, it started to pick up and intensify. And my husband ended up calling the midwives. And I thought I was worried that it might still be too early. But when they checked me, I was 6 centimeters and got in the tub. And the tub is always really wonderful for me. I guess I have gotten in the tub for every birth that I've had. I wasn't in it for very long with the first surrogacy. I was in there for just a couple of minutes, and they typically people don't give birth in the tub, but there wasn't time for me to get out. But all my other births have been water births. And so I was in the tub. It was going well, but seemed like it was taking a long time. I kept feeling like any minute now, I'm going to have that strong, unmistakable urge to push, and then it's all going to be over in a couple of minutes. And it just kept not happening. So at some point I turned to one of the midwives and I said, what's going on here? Like, is there an anterior lip? Like, what's happening? And they were like, I don't know, but we could check you if you want. And so the midwife checked me and she said, yeah, there is an anterior lip, but it's really soft. It can move right out of the way. But there's also this bulging bag of water. And if you want, we could break the bag and that might get things going. And I had, my first actually came out in her sac. And my second one almost came out in his sac. So I knew that it shouldn't necessarily be holding things back, but they were like, this might just be a little bit of a bigger baby and it may help. And really at that point, I was so ready. Like I'd been waiting for this shoe to drop for a long time. And I don't know exactly how much time, but it felt like a couple hours. And so I said, yeah, break it. So they put a tiny little hole in the bag of water. And 6 minutes later, the baby was born. And she was 9 pounds, 1 ounce. And my friend was in the tub with me and she was able to catch her own baby. So I was on my knees. I couldn't see her receive her baby, but she caught the baby. And then I was able to like flip around and just see her with her baby in her arms. It was pretty special. Yeah. And there were a lot of people in the room for that one too, because we had like the 2 midwives and the midwife student, my friend's sister, who was also taking pictures, my husband, who's my support person, my friend's husband, my two kids, and my mom to be there.
At that point?
They were, I think, let's see. This baby is 4.5. So like 16 and 12, about 11 or 12. Yeah, so they were older, but I had my mom also come just to run interference with them if they needed it.
It sounds like it was like a big birthday party in the room.
Yeah. Yeah, everyone was tired because it was in the middle of the night. Like the baby was born, I think, close to 6 o'clock in the morning. So that and it really kicked in around, I don't know, like 10:30, 11. So maybe everyone showed up around midnight or 1. But yeah, it was really, really lovely.
And what did your own family think about like your decision to be a gestational carrier and the pregnancy and the birth?
I mean, it was interesting. We had a lot of conversations before the first one. And when I first talked with my husband about it, he was like, okay, I mean, if you're really into that, but he really understood it if it was for somebody that we knew. He had a little bit of a harder time understanding doing something that intimate for somebody that we didn't initially know. But of course we got to know them. You know, it just feels like extended family now. And when I had the conversation with my daughter, it was interesting because we used to listen to like NPR on the radio, you know, our local station of OPB. And there was a story about surrogacy. So surrogacy is actually pretty big in Oregon. And they had on the owner of the agency that I actually ended up going with for that first surrogacy. So they were talking about it and we were listening to it just in the car. And I already knew I was thinking about surrogacy, but my daughter didn't. But when I told her about it, I was like, I've been thinking about doing this. What do you think? And she said, I think that'd be cool. Like she was super into it. And then when I talked to my son, who's 4 years younger, he was like, I don't want you to do that. And, you know, so I had to ask him some questions about why. And he's like, well, I wouldn't want you to be gone for a long time. I'm like, that's not part of it. So he had a little bit of trouble coming around. At one point, he said, I would be willing for you to have another baby, but I don't want you to give it away. And I was like, well, wouldn't be our baby. We'd just be taking care of it for a while. And, you know, so yeah, initially he was like, no, I'm not into it. But he was so casual about it. And just knowing what I know about my son, I thought, when he meets the intended parents, and I just needed to give him some time for it to process. But yeah, I feel like they dealt with it pretty well. I mean, they feel really special. Like they feel really warm and close with the surrogate babies. Like they're different than other babies to them, but not like a sibling.
Yeah. It's really cool that you were able to share like in those joys with your family too. Like they were with you through the challenges, but they also get part of that feeling of like doing good for other people.
Yeah, for sure. And certainly like having had the miscarriage helped me to know that, because when I thought about the birth initially, I was like, I don't know if I'll want my husband to be there or not, since it's not like our baby. And even just when we found out about the impending miscarriage, I thought, oh, I need my husband to be my support person. With the next pregnancy, when we went in for the ultrasound, I was like, you need to come in with me, because he had been sitting in the waiting room. And I was just like, shoot, I need a support person for me, even though they're not necessarily connected to this baby. Like he's just a person that I've always needed in my births to help me feel like I'm safe. And I know that's not true for all surrogates, but it was just true for me. And having had that initial process of the miscarriage kind of helped me to realize that and be clear on that going into the births.
Yeah, it's interesting how miscarriages can be losses, but also learning moments. Like you learn a lot about yourself and what you need and how you cope. And
yeah,
even with a surrogacy miscarriage, it sounds like it was still a learning moment for you as well.
It definitely was. And it also helped me I had some really good communications with the intended parents at that time. And they were really supportive. I kind of saw what they were made of. And I think they saw what I was made of. And, you know, because they were like, are you willing to do it again? You know, we didn't make any assumptions about what would happen next, but it felt really just warm and loving and respectful, the whole thing. And it's almost sometimes you learn more in those hard moments about what people are truly made of.
Mm-hmm. How can our listeners who are listening to this and are interested in learning more, maybe about supporting families who are using surrogates or the surrogacy or gestational carrier process itself, like what are some of the best resources you can point people to?
Well, I thought about this ahead of time, and I'm really sorry to say that I can't think of like a really awesome resource for all of those things. And I'm not saying that it doesn't exist. I feel like it's kind of a piecemeal thing. I can say, there's some good information on the website of the agency that I went through the first time. It's the Northwest Surrogacy Center. So it's nwsurrogacy.com, I think, because there's some information on there for people who are interested in becoming parents by surrogacy, and then also for people who are interested in becoming a surrogate. As far as supporting families through surrogacy, I think it's just good to keep a couple of things in mind. So one is not to make assumptions, thinking about your language. So we talk about this sometimes with trans people and non-binary people, and that's why a lot of times we say birthing person, but it's not just applicable for people who have different pronouns than who are not cisgendered. But when you're a surrogate, you don't always want to be called a mom. You're the person giving birth, you're the carrier. So if you're a person who's used to saying, oh, the mother or the, moms and babies, that kind of thing doesn't always apply when you're talking about surrogacy or even adoption.
Because I remember thinking, I've tried to be more careful in 2020 when we were refilming the Evidence Based Birth class, and it's not perfect. But I tried to think of like all different kinds of families and the language you use when you're teaching a childbirth education class, or even like teaching people reading the scripts about we're welcoming this baby. Like I had to be careful because some people are not welcoming like my baby. It's we're welcoming this baby. And so trying to think of like different ways to tweak the language so that no matter who takes the class, like this can be used by them.
Yeah. Yeah. And I would say in general, surrogates are not going to be too picky about the language, but it's just one of those things where if you're giving birth and somebody keeps saying like, great job, mama, you might just bristle a little bit. I think it's a little bit of what I was talking about earlier, that you have all these different people with different backgrounds, worries, fears, medical minds. And so it's just that much more to delve into. And that's why not making assumptions is great, because you just start with the open-ended questions. How do you imagine this going? What are your thoughts? What's been the conversation around feeding the baby? What kind of conversations have you had already? Would it be helpful to talk to the intended parents about the birth process, or have they been reading a lot or taking a birth class?
It also seems to me too that there are some doulas who are just really good at kind of shepherding these families through the process with their carrier. And oftentimes we'll get people reach out to us on Instagram, EBB, and I'll message back and I'll tell them, I know we have some EBB instructors who have been surrogates themselves or who love working with families who have a gestational carrier, and just like referring to those people, because I feel like they bring a lot, but I'm sure there are some newer doulas who also want to get involved. So I wonder if, we need more opportunities for them to shadow or be mentored by doulas who are more experienced in this.
That's a good idea. Yeah. Because I do think it can be really different. It really just depends on, sometimes you have maybe a heterosexual couple where they've experienced a lot of loss and grief, and they're still, even if they're moving forward with having a baby through a surrogate, there might be a lot of just complicated grieving feelings there. And then that's going to be different than what the surrogate is feeling. And oftentimes the surrogate is really sensitive to those things, but they may not know how to talk about it altogether. And that can be totally different from a gay male couple where maybe they've thought about having a baby for a long time, but they didn't obviously go through a long process of trying to get pregnant on their own and like going through a grief process of not being able to carry because they've always known that they wouldn't be able to. So just like the feelings around the pregnancy and everything else that goes along with it can be so different from birth team to birth team that it would be, it would be hard to just see one of those and know how to support families during surrogacy.
Yeah, that sounds there's a lot of complicated emotions. And then if you bring in, where there's a big financial burden on the intended parents, and that could also create more stress, I can imagine.
Is quite an expensive process, and it can be pretty hard for people to make it work.
Yeah. Yeah. Because then if you go through all those expenses and you still maybe don't come out with a baby on the other side, that could be really devastating as well.
Mm-hmm.
So Scarlett, thank you so much for sharing and being really open about your journey. I really appreciate you talking about, these very personal stories. How can our listeners follow you in your work as a doula and an EBB instructor?
Sure. Well, I will say I do have an Instagram, but I don't post a lot of things on it. It's Hatchings Doula, or at Hatchings Doula, and just my website, hatchlingspdx.com. Yeah, I have found that as a bite-sized content creator, it's just not my thing. I like the puzzles, and I like delving into the personal side of things. So creating content for a large audience just hasn't been.
And yet your classes still fill up and you're still super busy as a doula.
Yeah, I mean, I've been around for 13 years. And so there's that word of mouth. And there's also just that universe magic of not always needing to hustle and work on that marketing. Sometimes just the right people, they find me. Yeah. So hatchlingspdx.com, I'll write a blog entry every once in a while. Probably one of my more recent things, inspired by Evidence Based Birth, it was to crunch the numbers using the state of Oregon vital statistics. So for hospitals in the Portland area and their cesarean rates, using that data. So I wrote a blog which has this PDF.
Oh, cool.
So if anyone is in Portland, Oregon, and wanting to compare cesarean rates between hospitals using the state's data, they can check that out at my website.
Yeah. And there's a link at the top as well. It says compare hospital cesarean rates in Portland, Oregon. And also, if people want to work with you, they can obviously take your childbirth class through your evidence-based birth childbirth class.
That's right. And if they're looking for a doula, they can always book for free. Yeah, I've been teaching the class just virtually. Maybe someday in the future, I'll do another hybrid in-person virtual class, but haven't done it yet.
I also want to give a shout out to Molly Patterson, who's also in Oregon, who's a great doula and EBB instructor for families who are building their family through surrogacy. So we're really lucky to have the both of you in the Pacific Northwest and serving those families.
Yeah. Thanks so much.
All right, everyone. Thank you so much for listening in as we talk with Scarlett about the joys and challenges of surrogacy. I hope you learned a lot, and we'll see you next week. Thanks, everyone. Bye. Today's podcast was brought to you by the Evidence Based Birth Professional Membership. The free articles and podcasts we provide to the public are supported by our professional membership program at Evidence Based Birth. Our members are professionals in the childbirth field who are committed to being change agents in their community. Professional members at EBB get access to continuing education courses with up to 23 contact hours, live monthly training sessions, an exclusive library of printer-friendly PDFs to share with your clients, and a supportive community for asking questions and sharing challenges, struggles, and success stories. We offer monthly and annual plans, as well as scholarships for students and for people of color. To learn more, visit ebbirth.com/membership.